take a bill like I wrote with some colleagues, House Bill 3467, and send it to Legislative Fiscal Office and actually run the numbers on it. They refuse to have a hearing on any alternative plan that's not theirs. When you're not willing to look at alternative packages and funding, you're never going to get the solution, right? You're going to get the special interest, one party, here's your plan, take it or lose it, and then we're going to go out and pay somebody till we get that one vote. That's what happened.
Yeah. And I have a little, I mean, I support the bill that Cedric drafted. I helped him draft that. But I also drafted 2 other bills, and those bills were around the public employee health care costs. Like I said, we spend $1 billion more per capita across the public employee population, PEB and OEB, than the state of Washington does for their public employees. And those folks have fine health care. And I don't understand why ours is $17,000 a year and theirs is $12,000. But a gold plan in the exchange is about $11,000, and it's not 100% apples to apples, and I get that. But I'm of the thought that if there is one bucket of dollars called taxpayer-funded health care, then I do not care why you get it. I don't care if you get it because you're poor and you need it. I don't care if you get it because it's an employee benefit. It should be one bucket of dollars spread amongst everybody in a fair and rational manner. So whether that means we put people into the exchange and the difference is about $1 billion of savings there, and we use that to fund some of the things that Cedric's talking about. We didn't fully fund Measure 96. We couldn't get a bill for veterans to have oral health care that was $3 million, but we managed to find $10 million to fund abortions and $55 million for Cover All Kids. Neither of those 2 items being Medicaid match dollars, but they got to be paid for somewhere. And when we asked Representative Huffman on the floor, who was the carrier of Cover All Kids, how are you going to pay for this? He didn't know. He didn't know where the money comes from this session, or didn't know where it comes from in subsequent sessions. Well, we believe that surplus dollars pay for some of those kind of pet boutique project things that, we get to go get beat up over the head during campaigns with the next time around. So if we're serious about taking the poorest of the poor and solving those problems, then let's do that. But let's do that by spreading the wealth amongst the resources that we have. And you can't have people with Cadillac $17,000 plans while there's this contemplation that, well, maybe people might get kicked off the Oregon Health Plan. No one is going to get kicked off the Oregon Health Plan if we actually make rational, fair decisions with public resources. There is plenty of money to do both.
Do legislators get state health care?
We do. And I've had bills to put us into the exchange. They never got a hearing. So, people don't want to give up what they have. And you have to be willing to, everyone's shared sacrifice. You can't keep going to the well of taxpayers, and particularly taxpayers who have no lobbyists, and say, give us more money, give us more money, give us more money. While, people who run some of these healthcare associations make 7 figures with our tax dollars.